You're very welcome to this talk. It's Tuesday, the 17th of August. I want to do a bit of an update this morning, but first of all, let's look at some orientation. I've also been accumulating some frequently asked questions, so we'll maybe have a look at some of those. In fact, we can do the orientation and the FAQ at the same time. People are always saying, what is going on in Israel? What is happening in Israel? Well, let's look at what's happening in Israel at the moment. And we're looking as Israel as a sort of advanced leader following the seasons of the olive tree in Israel, metaphorically speaking. Anyway, so we've got Canada. Now, isn't it this great to see this reduction in the Netherlands as the vaccination campaign really takes hold there? That is such good news. I know we have quite a few people watching the Netherlands, so thank you for watching. And the direction there is good. It's not over, but the direction is good. Ireland, unfortunately, with a similar vaccination level, still going up though, so that's rather harder to explain. We must attribute that mostly to the delay effect for the vaccine kicking in. United States, numbers are going up. United Kingdom, this is a little misleading here with the numbers actually going up slightly at the moment, but Israel, we see the numbers are high. Now, variant-wise, United Kingdom, Netherlands, the United States, and Israel, it's all Delta variant. This is now a Delta variant pandemic. So basically, not much else to talk about. A little bit of Alpha variant, not quite squeezed out. Tiny amounts, but basically this is now a Delta variant pandemic. It's fully vaccinated people. Right, so this is interesting. You see, Israel, the number's high. It's high. But of course, it hasn't gone up a lot lately. But when we actually look at the number in Israel that's fully vaccinated, we see it's only about 62, 63%. Now, the implications for the United States here are huge. 62 or 63% of fully vaccinated people with the Delta variant is not enough to stop a parallel pandemic in the unvaccinated. I think that is the main factor in Israel. The second factor that people ask me a lot about in Israel is immunity waning. And you might think so because it's actually been some time. A lot of people in Israel have now been vaccinated for quite some time, quite a few months for people in Israel, February, March, April, May, June, July, August in Israel. But the data we have so far is actually indicating that the vaccine longevity is good in most cases with a proviso. And the proviso is that the long-term immunity is better if the vaccines are more separated. So Israel, and this is why it's important for the United States as well, Israel and the United States, the vaccines were only 3 or 4 weeks apart, whereas the UK, mine personally was 11 weeks apart, and I think this is having an effect. I think the gap between the vaccines, the longer gap is better. So I think they're probably the factors in Israel. I'm not so much worried about the longevity. It looks like some booster doses are being rolled out to vulnerable people in Israel now, as they are starting in the United States. But of course, the United States is very analogous to the Israel situation because it had the vaccines close together. And this is what's concerning. And the Delta variant is taking off in the United States at the moment, as we know. So, and the vaccination is increasing in the States, particularly in some southern states, but it's still not where we would like it to be. So we know that it's quite possible to have a resurgence of virus with vaccination numbers in this sort of category here, as we still see the island situation waiting to catch up as the vaccines take effect, but the Israel case is high, and hospitalizations in Israel also becoming a problem at the moment. So I thought that was quite interesting. Now, moving on to the UK, cases reported by date. Well, it is going up again, I'm afraid, at the moment. Cases are still going up. Healthcare-wise, the situation is nothing like as bad as it has been. Slight increase lately. Let's hope that's just an artifact. 882 patients in the last 24 hours. Patients actually in hospital, though, I think you'd have to say still gradually going down from that graph. So let's look at the news that caught my eye, basically. End of the pingdemic in the UK, the so-called pingdemic, people being pinged on the phones. So rules of self-isolation change. Yesterday, for England and Northern Ireland, people who are fully vaccinated or under 18 no longer have to self-isolate if they come into contact with someone who's tested positive. Now, this is a pretty big move because we know that some people that are vaccinated still become infected. We know that most people that are vaccinated don't become infected, but we know some do. They're unlikely to get sick themselves, although they can, but they're unlikely to. But they are infectious. So this is quite a big risk, and it's a major move from mandating behaviour to be responsible to appealing to the individual to be responsible. And this is quite a major shift. Now, I am fairly optimistic about this in the UK for the simple reason that when we had the release of the lockdown 19th of July, people didn't go mad. We're still being very, very moderate. I was talking to a church leader yesterday, still limiting services to 30 or 40 people with good ventilation, whereas normally you'd have 200-300 maybe. So people are being very cautious, which I'm pleased to see, and that's why the cases haven't taken off as dramatically as some of the dire predictions that we were getting from some of the prognosticators in the UK. Anyway, they no longer have to self-isolate when they come into contact with someone who tested positive. They'll be advised to take a PCR test. Now, this is the big weakness in this. So they're only going to be advised to take a PCR test, not mandated. They will not have to self-isolate while they wait for the result. People who test positive legally required to self-isolate for 10 days. So I think you can pretty well see the obvious sort of illogicality in this. People that can't afford to self-isolate or don't want to self-isolate aren't going to take the test. The people that would be prepared to do that responsible thing and get the PCR test, it's a self-selecting sample, isn't it? So it's advisory to take the test, and you're taking an advisory optional test, knowing that if you're positive, you will then be mandated to self-isolate for the 10 days. So there's a clear contradiction in the UK policy here, and it really is appealing to people to be reasonable about this. Professor Reich, a government's independent scientific pandemic influenza group on behaviours. Now, this is looking at the behavioural aspects. This professor's also on Independent Sage, I believe. Government's taking a big risk because behaviour is notoriously difficult to predict, as we saw with the previous lockdown. With the release from the previous lockdown restrictions on the 19th of July, when people were reasonable, but that was hard to predict. But for the most part, they were very reasonable. Professor Reicher concerned as infections and hospitalisations are both high, which is true. It's vital, he says, people take a PCR test if they come into contact with a positive case. But of course, this is optional. So how many will? How many will? If they're pinged, will they immediately go for a PCR test? Well, of course, a proportion won't. I think it might be a small proportion, but it's a risk. The problem is that if you now make it a choice to people as to whether to take a test, people aren't going to take the test in the first place if they can't afford to be positive or don't want to be positive. This is the weakness. People should remain very cautious and limited interactions, particularly with vulnerable people. So my appeal would be if people are pinged positive, of course, take a test. But if they don't take a test for whatever reasons, then please be very, very cautious with people around you that might be vulnerable. Or you may have contact with a healthy workmate, for example, who has someone who's vulnerable at home. So there we go. We are depending on the good behaviour of the British public. I'm fairly optimistic about it, but it is a risk. Now, I'm not going to dwell too much on this, but in the States, there's the politicisation is not what we want, really. But anyway, just Governor Cuomo, just about to leave office, actually, but all health workers, staff in hospital, nursing home, adult care and other congregate care settings must have one dose of vaccine by the 27th of September. So this is now being mandated. And we're seeing this in some states, mandating of vaccination. And of course, this is divided opinion, but it is being mandated in quite a few areas now. Governor Cuomo, prevent a danger to the health of people because of the Delta variant is his concern, except for religious or medical reasons. Now, there's very, very few medical reasons why someone wouldn't get vaccinated. I mean, the more people with more serious medical conditions, of course, it's even more in their interest usually to get vaccinated. Just a few people with immunological disorders or sometimes severe allergic disorders, but there's not that many medical contraindications to vaccination, really. And I'm struggling here a bit, really. Religious exemptions to vaccination, I don't know that. I mean, if you think about the major religions, is Christianity, no problem with vaccination that I'm aware of. Islam, as far as I'm aware, no problem with vaccination. Hinduism, no problem with vaccination. I really don't see why there would be a religious objection, as religious leaders around the world have come out in favour of vaccination. So, but anyway, that's what the law's saying. It's a mandate from the governor. Fully vaccinated so far. Now, this was interesting. This is for New York State. So only 75% of hospital workers, and there's nearly 500,000 of them in New York State, 450,000 hospital workers, so 25% have not been vaccinated. That is really hard to believe, because these are the people that should understand the nature of immunity and the nature of contagion. But it seems many don't, which is surprising. Or even if they're not clinicians themselves, people who work in hospitals have got ready access. They can have a chat with doctors and nurses and biochemists over a cup of tea or something. You know, it's that surprised me that it's 25%. Adult care facility workers, 74% have been vaccinated. So again, 26% not vaccinated. 30,000 of those. Nursing home workers, only 68% vaccinated. So quite a high proportion not vaccinated for particularly vulnerable people in nursing homes. And again, there's 145,000 of those. So these are affecting a lot of people. This mandate is going to affect a lot of people. Unlike state workers. Now, state workers in New York State have to be vaccinated or tested once a week. But for these healthcare workers, no test out option. So they will have to be mandated or not go to work. More than 1,700 people are hospitalised in New York State at the moment. So hospitalisations in New York State, nothing like as bad as they were, because New York was so bad last year, remember. But they are high, still causing stress, still delaying other cases. Not as bad as southern states with lower vaccination uptake. California and Washington State already require vaccination for all the people in direct contact with patients. Also, New York City, soon museum staff and visitors are going to have to be vaccinated. So you can't go to a museum unless you've had full vaccination. Surprisingly, there's 33 venues. So again, you know, it's actually quite a lot. The potential for spread there is certainly there. So Med Brazio, defeating the Delta variant is the best way to support cultural institutions, because it brings us all back, which of course is everything we want. We just want to get back to these things. Don't go to museums very often, but you know, if you get the chance to go to the British Museum, I can spend all day there easily. You know, it's fascinating. To include bars, gyms, theatres and indoor venues. So all of these people are going to need to be vaccinated, which means there's going to have to be some way to check on that, of course. That's going to take effect on Tuesday. It's going to be enforced Tuesday, today, of course, going to be enforced from the 13th of September. Now, on the other side of the spectrum, Texas Supreme Court, and this bit is difficult to understand, really, for an outsider. Texas Supreme Court permitted the mask mandate ban. So the mask mandate ban, in other words, the governor said you can't mandate mask wearing to stand. So that's standing for the time being, although I think it's been kicked upstairs to a more senior court. So why would the governor ban mask mandates when hospitalisations in Texas are 4 times what they were last month? I'm sorry, I don't understand. I just don't get it. There's about 14,000 new daily cases in Texas. So why would the governor ban mask mandates when it's appropriate? Sorry, I thought, you know, we need to defend people's health, I would have thought, and wearing a mask is not causing any economic harm. So as an outsider, I really just don't understand why you would do that. Anyway, moving on to Australia. Hundreds of soldiers patrolling the streets in Sydney. So the Australians are taking this very seriously. Curfew 9 p.m. to 5 a.m. That is quite a dramatic curfew in Victoria. The whole state of Victoria, as far as I know. Darwin, city in the Northern Territories, named after Charles, of course. 72-hour lockdown after a single asymptomatic infection. So Northern Territories really don't want this around Darwin and the Northern Territories. Virus is spreading from Sydney into New South Wales, and a big concern now is First Nation groups. Government have prioritised First Nation groups for vaccines, but over 16s, 15% of First Nation peoples are vaccinated, as opposed to 26% in the general population. So, and these people are often at very high risk, so it's a slow rollout. The government rightly say they often live in outback rural areas, but there's plenty of trucks in Australia. Risk factors and lack of healthcare facilities in the bush. So First Nation peoples more risk factors for severe disease, and if they do get sick, then the healthcare facilities can be quite a long way away, which could be an issue, which is why they're being prioritised. Western New South Wales, 98 cases, mostly in Indigenous people. So this is, we don't know exactly how many of those 98, but we assume it's about 90 of them cases spreading in Indigenous people already, which means it is now there. And that is a big concern. That is a big concern. This is one of the elders groups in New South Wales. Many of our elders and others in Waglet. This is a town with, I think, a majority First Nation population. Experience health and social issues that make them vulnerable to contracting COVID-19, yes, but also make them vulnerable to getting severe disease if infected, which is particularly the issue, really.